Hello everyone. Very good evening to all of you. I welcome you all for today's session. In today's session, we are going to study ophthalmology. And in ophthalmology, I'm going to continue retina disorders. In today's session, I'm going to take a very important topic in retina disorders, that is retinopathy of prematurity. It's also known as ROP. It's a very tricky topic. It's not difficult, but it's very tricky. And I'm going to teach you in a super simplified, super interesting way, right? So let me share my screen quickly with you and start the session. I guess you can see the screen, right? Let me confirm. Yes. I guess you can see the screen. So as I told you, in this batch, the third Professor 1.0, today's subject is ophthalmology. And in ophthalmology, we are going to study ophthalmology in a unique way with 3D models, the physical as well as digital. Today's topic is retina disorders. We are going to continue it. We have already studied many important retina disorders. We have covered retinal vasculitis, diabetic retinopathy, hypertensive retinopathy, retinopathy in pregnancy-induced hypertension. Today's topic is retinopathy of prematurity, ROP. Today's topic is ROP. So let's start ROP. Now you usually get a long question in your exam based on this topic. So if it is coming as a long question, you have to write your answer under these headings. And believe my words, you get many MCQs on this topic, the retinopathy of prematurity. And I'm damn sure after attending this session, you will be able to crack any MCQ based on this topic. So under these headings, we are going to describe our answer, the long question, one by one. Let's start it. So let's start with the introduction. Can you see the introduction? Let's start introduction. What is retinopathy of prematurity? What is ROP? Can you tell me what is ROP? So ROP is also known as retrolental fibroplasia. What do you mean by the term? You will understand the term. Okay, if you understand the pathogenesis of this disease, you will understand this name also. Retro means behind. Lental means lens. Behind the lens, behind the lens, in the vitreous humor, in the vitreous cavity, there is fibroplasia. So there is fibroplasia behind the lens. That's why it is known as retrolental fibroplasia. That's the other name given to ROP. So what is basically ROP? Why it is known as retinopathy of prematurity? Because it occurs in premature newborns. The newborns who are premature. In them, this disorder occurred. That's why it is known as retinopathy of prematurity. So what is actually happening in the retina? There is some problem happening obviously in the retina of the eyes of the newborns, of the premature newborns. So there is bilateral. This disease is bilateral. First of all, ROP is bilateral. Bilateral proliferative retinopathy. In the retina, there is some proliferation. Proliferation is taking place in premature newborns. The newborns which are born with low birth weight, whose birth weight is less than 2 kg. These are premature newborns, the premature infants whose birth weight is low birth weight. They are LBW. You have studied LBW. I taught you LBW in community medicine. So they are low birth weight newborns. Their birth weight is less than 2 kg and they are premature. And because they are premature, they are exposed to high concentration of oxygen. They are exposed to high concentration of oxygen in the incubators after their birth. And that is the most important risk factor. If there is a newborn who is premature, who is low birth weight, and is exposed to high oxygen concentration, that will induce the synthesis of more VEGF. That will be the culprit and that will lead to this disease. The name of the disease is retinopathy of prematurity, ROP. I hope you are getting the definition. You don't have to learn the definition. You don't have to learn the introduction. What is ROP? Look at this image and try to frame your own definition. What is ROP? Say. So say, ma'am, ROP is a bilateral disorder which occurs in the newborn. Can you see a newborn? Which occurs in the newborn which are premature. Number one, they are premature. Their birth weight is less than 2 kg. They are LBW. They are premature. They are LBW. Their birth weight is less than 2 kg and they are exposed to high oxygen concentration after their birth in the incubator. And that induces the formation of more increased amount of VEGF and this will lead to ROP. And it's a bilateral proliferative disorder of the retina. So this is the definition. You can frame the sentences definition of your own. You have to understand what is actually happening in the disease. You have to describe in your own language. That is ROP. So this is retinopathy of prematurity. Why it's happened, I will let you know in the pathogenesis. But first you understand the definition. This is the definition of ROP. Now coming on the risk factors. Before coming on the pathogenesis, let me tell you the risk factors of ROP. So there are two types of risk factors, primary risk factors and others. Primary, there are 3 primary risk factors at the tip of your tongue. What are the 3 primary risk factors? First of all, low gestational age. Low gestational age. If the newborn is born before 32 weeks of gestation. So normally the newborn are born after 36 week. Okay, so if the newborn is born before 32 week of gestation, the premature newborn, the premature birth. Okay, so that is the most important risk factor. And its birth weight is less than 2 kg, especially less than 1250 grams. If the birth weight is less than 1250 grams, any birth weight, if the birth weight is less than 2 kg, it is known as LBW. So it is LBW, but it is, extreme LBW, VLBW, you can say, very low birth weight. It is less than 1250 grams. So it's low birth weight. And because of which, supplemental oxygen is given in the incubator. In the incubator, we are giving high oxygen, to save the baby. So these are the 3 most important risk factors for producing ROP in a newborn. What are the 3 primary risk factors? Number 1, gestational age is less. It is premature. How much? Less than 32 week of gestation. So if the birth of the newborn is taking place before 32 week of gestation, that is the biggest risk factor. And obviously, if it is premature, that's why the birth weight is also less. The birth weight is less than 1250 grams. And high concentration of oxygen is given to save the baby in the incubator after the birth. So these are the primary risk factors, the most important 3 primary risk factors. Don't mug up. See the image. Take a snapshot of the image, not in your camera, in your mind. Take a snapshot like this in your mind. The 3 important risk factors for ROP. Okay, low gestational age, low birth weight, supplemental oxygen. These are the 3 most important risk factors. Okay, and other risk factors, you can learn the list. Vitamin E deficiency, respiratory distress syndrome, birth asphyxia, shock, acidosis, if any of them is occurring during birth, at the time of the birth. So if any of them is present in the newborn immediately after birth, that will be additional risk factor. Okay, so there are 2 types of risk factor. So we have already seen the introduction. We have already seen the risk factors, the primary risk factors and other risk factors. Now let me tell you the pathogenesis of the disease. Let me come, I'm sorry. Let me come on the pathogenesis of the disease. Why does this disease happen? The retinopathy of prematurity, ROP. Retinopathy of prematurity, why does it occur? Why does it occur? You tell me. Now, during intragestational period, when the fetus is inside the womb of the mother, inside the uterus of the mother. Can you see a fetus here? Can you see the fetus is inside the uterus of the mother, inside the womb of the mother? So, development of all organs takes place. Organogenesis takes place. So, development of retina also takes place. In the retina, the retinal blood vessels grow. So, can you see? These are the eyes. Inside the eyes, the retina. In the retina, the retinal blood vessels are formed. They are developed. So, retinal vasculature development takes place intrauterine. In intrauterine life, in the 3rd trimester. In the 3rd trimester, intrauterine life, the vasculature of the retina is getting developed. You can see in the image. Okay, so who's the most important factor which regulates the vasculature of the retina? Now see this image. In this image, can you see the optic disc? Say yes. This is the optic disc. In the optic disc, can you see the central retinal artery? Yes. So inside the optic disc, can you see a central retinal artery? Appreciate, this is central main retinal artery from which 4 branches are arising. I taught you the blood supply of retina in my first episode. Watch that episode, the anatomy. I taught you the 4 branches of the retinal artery. So you can see superior nasal, superior temporal, inferior nasal, inferior temporal. So you can see superior, inferior, nasal and temporal. The four branches from the central retinal artery are arising. They are just arising. Now they grow. They keep on growing at 8 months of gestation. At 8 months of gestation. And who is causing the development of these branches, these retinal arteries? It is VEGF. What is the full form of VEGF? Vascular endothelial growth factor, VEGF. Say the full form. It's vascular endothelial growth factor, VEGF. VEGF regulates retinal vessel growth. Can you see it is regulating the retinal vessel growth? VEGF is regulating the retinal vessel growth. Okay, and these vessels are reaching the nasal retina. They grow. Can you see they are growing and they are reaching the nasal. This is nasal end. They are touching the nasal end of the retina at 8 months of gestation. At 8 months of gestation. And they reach the temporal. This is temporal end of retina. Can you see? They are reaching the temporal end of the retina 1 month after birth. 1 month. So birth takes place at 9 months. The gestational period in humans is 9 months, 9 days, plus minus. So 9 months, 9 days, the birth is taking place. And after 1 month of the birth, they are reaching the temporal end. So basically, complete vasculature develops after 1 month of the birth. So they reach temporal retina 1 month after the birth. You can see this is complete vasculature development of retina. Normally, it takes place like this. So say what I have said. I have said that, during intrauterine life, when the fetus is inside the uterus of the mother, organogenesis takes place. So organogenesis takes place in the eye, in the retina, in the retinal vasculature also. So organogenesis has started. I can see the optic disc, I can see the retinal artery, I can see the 4 branches of the retinal artery. They just started. Before 8 months, they just started. Now the branches grow. So this is nasal end and this is temporal end. They will grow when they reach nasal end and when they reach temporal end. It's not simultaneous. So these retinal branches, the 4 branches coming from the central retinal artery, they grow. They first reach the nasal end. Can you see this end? They are touching nasal end. So they are reaching the nasal end at 8 months of gestation. After that, the birth takes place at 9 months, 9 days. And 1 month after birth, they reach the temporal end. So 1 month after birth, the complete development of the retina takes place. Now suppose if the child, the newborn is taking birth before 8 months. If the newborn is taking birth before 8 months, what's going to happen? So this is how the complete development of the retinal vasculature. See, this is the central retinal artery. It is arising from the optic disc. You can see the 4 branches. These 4 branches first reach the nasal end at 8 months of gestation. And these 4 branches reach the temporal end at 1 month after birth. This 8 month is gestational life and this 1 month is after birth. I hope you are getting it. So first they are reaching the nasal end, then birth of child take place, and after 1 month of the birth, okay, they are reaching the temporal end gradually and slowly. This is how complete development takes place. But there is a problem in premature infant. If the birth is taking place before 8 months, suppose newborn born before 8 months, what's going to happen? You tell me. Use your common sense and tell me. If there is a premature birth, so VEGF is downregulated. For this complete development, one factor is required in the blood, that is VEGF. So in premature infants, VEGF is less. Okay, it is halted. As soon as they are born, it is halted. Since VEGF is halted, VEGF is downregulated, there is arrest of retinal vessel migration. Gradually, the retinal vessels are migrating. The 4 retinal branches, they are arising from here. They are migrating. First, they touch the nasal end and later on, they touch the temporal end. And this is how they are supplying the blood to complete retina after 1 month of birth. You can see this is at 8 months, this is at 10 months, 9 to 10 months. This is complete development of the retinal vasculature. But if the birth is taking place before 8 months, the migration halted at that place only. The migration, learn this word, there is arrest or haltation of the retinal vessel migration. Okay, it will get halted. Can you see the retinal blood vessels just started from here? See, this is the optic disc. You can see the 4 branches have started migrating. But if the birth is taking place at this place, so they halted here only. They have not covered full 100% retina. Wherever they are, they just halted there only. They just halted. Now, that is the first problem. The haltation or the arrest of the retinal vessel migration. That is the first problem. Now, with increasing age, as the child grow, the newborn grow, there is increased metabolic demand. As a compensation, now VEGF will increase. As a compensation. At the time of birth, it's halted. VEGF is less at the time of birth because they are premature. So VEGF is less, so migration halted. But later on, with increasing demand as a compensation, VEGF will increase suddenly. Later on, VEGF will increase along with IGF. IGF is insulin growth factor, insulin-like growth factors. Both of them increase later on as a compensation. That will lead to neovascularization. The original blood vessels are already halted. They will not grow now. They will not grow, because VEGF concentration is less at that time. Now later on, if VEGF is more as a compensation because of increased metabolic needs, these blood vessels, mind my words, these blood vessels which are already halted, they will not start growing. No, they will not start growing. They are permanently halted. Now no one will grow them. They are permanently halted. But now since the VEGF is more, the new blood vessels are formed at their ends. Can you see? These are new blood vessels. The new blood vessel is known as neovascularization, and that is the biggest problem in ROP. Neovascularization. The new blood vessels are formed. New blood vessels. The problem is that the new blood vessels are leaky. They are very leaky. They will rupture. So bleeding will take place. Vitreous hemorrhage. Then whenever bleeding takes place, fibrosis takes place, so there will be fibrosis. Wherever there is a neoplasia, there will be fibrosis, because the neoplasia lead to rupture, and rupture lead to bleeding, and bleeding lead to healing. Healing leads to fibrosis. So there will be fibrosis in the vitreous cavity. The fibrosis in the vitreous cavity, and that leads to ROP. That is the problem in ROP. How many of you got it? So this is the problem in ROP. So what's happening in ROP? The problem is that the newborn is born before 8 months of gestation. It's a premature newborn. It's a less gestational age newborn. The newborn is not 8 months. If the newborn is born after 8 months, it's good. It's normal. But if the newborn, many births takes place before 8 months. So before 8 months of gestational life, the newborn is born. It is out of the womb of the mother. It is out of the uterus of the mother. So VEGF stop. VEGF halted. VEGF. It is down regulated. Since it is down regulated, the retinal blood vessels migration stop. Wherever they are, they just stop. Can you see? They just stop here. They are not going ahead. No, they have just stopped. With increasing age later on, there will be increased VEGF as a compensation with increased metabolic demand. Now VEGF is although increased. You will say, ma'am, now it's increased. Now these blood vessels should continue. They are continued. They should continue their migration. No, these blood vessels once halted. The retinal blood vessels once halted, they will never start regrowing or migrating again. They are permanently halted. Now the increased VEGF will form the new blood vessels, which is known as neovascularization. You will say, ma'am, what's the problem? If they are new blood vessels, it's okay. No, these are not same retinal blood vessels. These are new blood vessels. They are leaky. They will rupture. They will cause the vitreous hemorrhage. Whenever there is a hemorrhage, there is healing. Healing leads to fibrosis, and fibrosis leads to contracture, and that leads to ROP. Okay, so why it is known as ROP? Now you understood the meaning. So it is retinopathy of prematurity because it occurs in premature newborn in which the retinal blood vessels are halted because of down regulation of VEGF at their birth. So the complete problem is that the newborn is born before 8 months of gestation. That is the problem. If the newborn is born after 8 months of gestation, there is no problem. But if the newborn is born before 8 months of gestation, there is high risk of ROP because the retinal blood vessels will be halted wherever they are and they will not start growing again. So that is the pathogenesis. You have to learn, understand, and draw this flow chart in your exam, and you have to understand this for your MCQs also. This is how ROP takes place. So I hope you got it. In ROP, the biggest culprit is, prematurity. If the newborn is born before 8 months of gestation, because of which the VEGF is downregulated. That's why the retinal vasculature growth is halted. At that point only, they will not grow further. Now with increasing age, when there is increasing metabolic demand, as a compensation, VEGF initially halted. It is downregulated. Now it is upregulated as a compensation. But the retinal blood vessels will not continue to migrate now. The new blood vessels is formed. That's neovascularization because of increased VEGF. And that will lead to fibrosis and that will lead to ROP. So I hope you all got it. So till now, everything was okay. Now, the session is tricky. The topic is tricky. So pay attention. So let me come on the clinical features. What I taught you till now. I am teaching you a topic, retinopathy of prematurity, ROP. I already taught you the definition. In the definition, I already taught you it's a bilateral disorder of the retina, which occurs in premature newborns, premature infants, okay, in which there is fibrous proliferation in the retina. Why there is fibrous proliferation? Because of neovascularization. So the problem is neovascularization in the retina. Why neovascularization? I taught you in the pathogenesis. Risk factor, there are three main risk factors. The primary risk factors you must know. What are the three main risk factors? Low gestational age, okay, low birth weight, LBW, low birth weight. And the third is high increase oxygen concentration at birth, supplemental oxygen. That will increase further VEGF. That oxygen that will increase the compensatory VEGF, so there will be more neovascularization if supplemental oxygen is given. So these are the primary risk factors. After that, I taught you the flow chart of the pathogenesis. You must know. First, you draw normally what happens, then you draw in premature infants what's happening. So draw two flow charts as I have drawn. Okay, I have shown you. Now, coming on the clinical features. To understand the clinical features, I want to teach you three things. Please see the three things. Stage of disease, zone of disease, and extent of disease. People, it's tricky. I'm warning you, it's tricky. So pay attention. Please understand the difference between staging, zone, and extent. Okay, there are 5 stages in the disease. I will tell you. Stage 1, 2, 3, 4, 5. There are 3 zones in the disease. Zone 1, Zone 2, and Zone 3. Okay, and there are 2 extent. Plus disease, without plus disease. I will try to explain. The complete treatment depends on the staging, zoning, and extent. So please understand. So first I will teach you stage of disease, then I will teach you the zones of the disease, then I will teach you extent of disease. This complete clinical feature classification, the stage, zone, and extent is given by International Classification of ROP. It is known as ICROP, International Classification of ROP. So let's start with the stage. What are the stage? There are 5 stages in ROP. What are the 5 stages in ROP? Let me tell you the 5 stages of ROP. They are in front of you. It's very easy. Okay. So as I told you, the retinal blood vessels halted if the birth is premature, okay, if there is a newborn who is born before 8 months of gestation, so retinal blood vessel, can you see the retinal blood vessel? Say yes. Can you see? They halted there only. Their migration is halted. They are arrested. They are not going further. So can you see, ma'am, the retina is divided in two portions. This is vasculated, I mean, the perfused retina, and this is ischemic retina. So there is a junction between the two. The point where the retinal blood vessels are halted, they are arrested. This is the point where they are arrested. So on one side of them, the retina is perfused. On other side of them, the retina is ischemic. Okay, so there is a junction. So there are 5 stages. Let me tell you what is happening in stage 1. There is a demarcation line between the vascular and avascular retina. Can you see? This retina is vascular and this retina is avascular. This is avascular. And I can see a line. Call it demarcation line between the two. Okay, call it a demarcation line. So this is the line. Till that line, the retinal vasculature is migrated. And after that, they are not migrating because VEGF is downregulated. So you can see these are the retinal vasculature. They are migrated till this point. And after that, their migration is halted. Okay, so this is vascular retina and this is avascular retina. And there is a line between them. This is stage 1. This is stage 1. There is a demarcation line. There is a demarcation line. Now, initially it was a line. Line is 2D. Line is 2D. It will take 3 dimension. So instead of line, I will call it a ridge. The same thing. Instead of line, it becomes 3-dimensional. I will call it a ridge. There is a demarcation ridge. Instead of demarcation line, it is a demarcation ridge. Line is 2 dimension. Okay, it is having a length and width. Now it will gain some height. It will gain some height. So it convert into ridge. Okay, so instead of line, call it a ridge. And from 2D, it becomes 3D. This was 2-dimensional. Now this becomes 3-dimensional. I hope you are getting it. So the same line converted into ridge. The demarcation line converted to demarcation ridge. Demarcation line converted to demarcation ridge. Okay, between vascular and avascular retina. Between vascular and avascular retina. So this is stage 2. In stage 2, the ridge is formed. Demarcation line develop the height and it convert into a ridge. And it convert into a 3-dimensional figure, that is ridge. Now, from this ridge, the new blood vessels start forming. Okay, the new blood vessels. New blood vessels start forming. So neovascularization will be there. That will lead to fibrovasculature. That is known as fibrovasculature. Can you see the neovascularization? From this ridge, the new blood vessels are formed because this complete retina is avascular. No? This is avascular. This is vascular. This is avascular. So that is again as a compensation, the VEGF will increase. The VEGF cannot start the migration of the original blood vessels, retinal vessels again. It will lead to formation of new blood vessels. The new blood vessels is neovascularization. That is known as fibrovascular proliferation. So stage 3 is fibrovascular proliferation, which is starting at that ridge. Appreciate. Here it was a line. Say yes. Here it was a demarcation line between vascular and avascular retina. Here the line convert into ridge between vascular and avascular retina. Here from that ridge, the fibrovascular proliferation, that is neovascular proliferation taking place. Okay, so neovascular proliferation takes place from that ridge. Okay. So that is stage 3. Okay. Now, whenever there is neovascularization, what's happened? I told you, the new blood vessels are leaky. The new blood vessels, these are leaky. So they will rupture. Since they will rupture, the hemorrhage takes place. Whenever there is hemorrhage takes place, the healing takes place. In the healing, fibrosis takes place. What is fibrosis? Fibrosis is contracture. I taught you in pathology. Fibrosis is contracture. So it will contract. Okay, in the vitreous. Imagine this is vitreous. In the vitreous cavity, this is contractures. They will contract. Since they will contract, so they take the retina with them. So the retina, can you see the yellow retina? This will separate from the choroid. Because these are the contracture. They are pulling the retina. The contractures, the various contractures are there. They are pulling the retina towards them. Okay, so retina will separate from the choroid and it is known as retinal detachment. So in stage 4, the retinal detachment have started. Can you see it is started? And there is a space between the choroid and the retina. Can you see this blue color space? Appreciate this blue color space between the choroid and the retina. This is retinal detachment. It is partial retinal detachment. Okay, partial. It is 4A and 4B. If the retinal detachment is not involving macula, it's 4A. If it is involving macula also, it's 4B. Can you see? So here it is 4A, you can see. And once it will involve the macula also, it becomes 4B. Okay, it's partial. One time will come when complete retina will detach and it's stage 5. In stage 5, this blue space will increase and complete vitreous cavity become blue. Can you see this is yellow retina? In this diagram, the retina is yellow color. Appreciate the yellow retina. Appreciate the yellow. Appreciate the yellow. Appreciate the yellow started separating. Appreciate this yellow. Appreciate this yellow. It started separating from the underlying red. The underlying red is the choroid. Can you see? So there is a space between the retina and the choroid. This is partial retinal detachment. And gradually the space is increasing. The complete retina is at the center in a funnel shape. Okay, and it is separated completely from the choroid. And this is complete retinal detachment. That is stage 5. Stage 5 is complete retinal detachment. You can see these are the fibrous band I was talking about in the vitreous cavity. These fibrous band are pulling, use the word pulling. They are pulling the retina towards them. And that's why the retina gets separated from the choroid. You can see this is choroid and the retina gets separated from the choroid. The retina gets separated from the choroid. Can you see the retina gets separated from the choroid? The retina gets separated from the choroid. And stage number 5 is total retinal detachment. The retina become completely funnel shape. You can see the retina become completely funnel shape and it is total retinal detachment. Stage number 5. You can see this is retina. Can you see? It is separated completely from the underlying choroid. This is total retinal detachment. So there are 5 stages. What are the 5 stages, people? What are the 5 stages? You can see the same 5 stages over here also. You can see first you revise here, then I will show you one more diagram. What are the 5 stages of ROP? First, between the vascular and avascular retina, a demarcation line is formed. That line will gain some height and I will call that line as ridge. So instead of line, it will be a 3D ridge. Okay, first it is a 2D line, then it is a 3D ridge. Then on that line, the neovascularization started, stage 3. Okay, now that neovascularization convert into fibrosis and fibrosis will contracture and there is partial retinal detachment. You can see partial retinal detachment is stage 4 and complete retinal detachment is stage 5. You can see the complete retina is detached. You can see the same over here. First you see a line, say yes in stage 1. The line convert into ridge. Say stage 2 between vascular and avascular retina. Between vascular and avascular retina. On that ridge, the neovascularization is taking place. In that neovascularization, the fibrosis is taking place. The fibrosis is pulling the retina. So there is partial retinal detachment, then complete retinal detachment. So stage 4 and 5. The same you can appreciate here. Whatever diagram you want, you can draw. So basically, we have learned 5 stages. Can we revise the 5 stages, people? Can you help me? Stage 1, 2, 3, 4, 5. The 5 stages of ROP. Tell me what is the meaning of 5 stages. In stage number 1, a demarcation line is formed between vascular and avascular retina. In stage 2, that line convert into ridge. A demarcation ridge is formed between vascular and avascular retina. On that ridge, neovascularization started. In stage 3, that neovascularization convert into fibrosis. Fibrosis will contract, they will pull the retina and it will lead to partial RD, partial retinal detachment. Gradually, the complete retina will detach. There is complete retinal detachment, it becomes funnel shape. So that is stage 5. So these are the 5 stages you have to learn in one word. Okay, rather than mugging up, please understand the pathogenesis. This is how 5 stages are there. So I hope everyone got the 5 stages. Say yes, you all got the 5 stages. Now come on the zone. Come on the zones of the retina. After staging, come on the zones of the retina. What are the zones? There are 3 zones in the retina. Zone 1, zone 2, zone 3. There are 3 zones in the retina. Okay. Let me tell you the 3 zones. Optic disc is the center for these zones, not the fovea. Okay. In some diseases, we take the center as fovea. In some diseases, we take the center as optic disc. I taught you hypertensive retinopathy. Yes or no? In hypertensive retinopathy, I taught you clinical significant macular edema or macular and all these. So I taught you there the center as a fovea. Here in ROP, for zoning of ROP, we take optic disc as the center. Okay. So zone 1, 2, 3. One by one we will take. Can you see here? This is retina. On the retina, where is the optic disc? Can you appreciate the optic disc? This is optic disc at the center. This is optic disc at the center. I'm marking with blue color. See. The optic disc at the center. Say yes. This is optic disc at the center. Say yes. Okay. Optic disc is at the center. Now we are making a circle, taking optic disc ka center as center. Okay. What is the radius of the circle? The radius of this circle is twice the distance between optic disc and fovea. So can you see this is optic disc? Let me mark again. This is fovea. This is fovea. Fovea is the center of macula. Watch my session on anatomy, people. Please do watch. Okay. So this is optic disc. This is fovea. I'm marking optic disc with blue color. Chalo, I will change the color. This is optic disc, which is blue color. And this is fovea, which is yellow color. Say yes. Can you see the optic disc and fovea? Say yes. Can you see the distance between the two? This is the distance between optic disc and fovea. Take the double of this distance. Take. This is one distance. Take one more. take one more. And whatever is the distance, twice the distance between optic disc and fovea, twice the distance, make a circle. This is zone 1. This is zone 1. I hope you got it. I'm drawing it for you people. Everyone see, this is retina, say yes. This is optic disc, say yes. This is fovea, say yes. Can you see this is fovea? Here is the fovea. So I have drawn the optic disc. This is optic disc. And this is fovea. Fovea is the center of the macula. Okay. Now can you see a distance between them? See the distance between the center of optic disc and center of fovea. Okay, take the double of this distance. One is already in front of you. Take one more. The same distance. Duplicate it. Take one more. Now from the center of the optic disc, can you take the center of the optic disc? Make a circle. Taking this as a radius. Taking this as a radius. Take this. So what is the radius of this circle? This is zone 1. Call it as zone 1. So what is the radius of zone 1? What is the radius of zone 1? Radius of zone 1 is from here to here. This distance is twice the distance between optic disc and fovea. So this is one time distance between optic disc and fovea. This is double. So it is twice the distance between optic disc and fovea as the radius for this zone. And this zone is known as zone 1. You know, the most dangerous zone in which ROP can take place. This is zone 1. It is twice the distance between optic disc and fovea. Okay. And it represents the posterior retina. In this zone, the disease is very severe. This is zone 1. Appreciate the zone 1. Say yes. So again, see in this diagram, where is optic disc? Here is the optic disc. Where is fovea? Here is the fovea. Take the distance between them and double it. Take the distance between them and double it. Take it as a radius and make a circle. Make a circle. This is zone 1. So zone 1 is done. I hope you got it. Now coming on zone 2. What is zone 2? In zone 2, we make a circle. Again, the center is optic disc only. But here, the radius is distance from the center of the optic disc to nasal oral serrata. Can you see? This side is nasal. Okay, and this side is temporal. Watch my first session. I have explained what is nasal and temporal. This is nasal, this is temporal. You know what is nasal, what is temporal? This is nasal and this is temporal. Take the center as center of optic disc. Okay, the center as center of optic disc, and take the nasal end as a radius. Now make a circle from here. Make a circle. So this circle is towards the nasal end, and this is zone 2. The distance between zone 1 and zone 2 is the zone 2. You know, the distance between the first and second circle is zone 2. So the area between zone 1 and this boundary is zone 2. You can see. So I will draw it again for you. So first draw the complete retina, the posterior pole. Say yes. In that, draw optic disc and draw fovea. Okay. So this is optic disc. I am marking it with blue color. And this is fovea. I am marking it with yellow color. Fovea is the center of macula. Write it. This is optic disc and this is fovea. I cannot mark directly zone 2. First, I have to mark zone 1. Where is zone 1? In zone 1, I will take the distance, the center as the optic disc. I will make a circle. The center is the optic disc. And what is the radius of this circle? The radius of this circle is the distance between optic disc and fovea. Optic disc and fovea. Take this distance and double of this distance. Twice the distance between optic disc and fovea. Take it as a radius and make a circle. This is zone 1. This is zone 1. For zone 2, again take the center as optic disc only. This time also the center is optic disc. Okay, you can see I'm drawing the center as optic disc only. The center is optic disc. But the radius this time is from optic disc till nasal ora serrata. Till nasal ora serrata. Okay, take this as a radius. Can you see the radius? And make a circle from here. Make a circle from here. Okay, make a circle from here. So this is zone 2. This is zone 2. The distance between the red and the green circle. This is zone 2. The moderately severe, not very severe. Very severe is zone 1. Moderately severe is zone 2. Okay, now whatever area left, okay, towards the temporal crescent, this is zone 3. Can you see the yellowish one here? The whatever area left is zone 3. I hope you got it. The zone 1, zone 2, zone 3. Appreciate it here. Appreciate. Shall I draw it again last time? Can you see this diagram? This is retina. This is the posterior pole of the retina. In this posterior pole of the retina, first you identify this is optic disc and this is center of macula, that is fovea. Macula lutea, this is fovea. So draw the zone 1. For drawing zone 1, the center for all 3 zones is the center of optic disc. Okay, what is the radius that matters? The center for all 3 zones is the center of optic disc. See, I'm drawing a red dot. That is the center for all 3 circles, all 3 zones. But what is the radius? What is the radius? For zone 1, the radius is twice the distance between optic disc and fovea. See optic disc, see fovea, take a distance between them and double it out. Double it out. Can you see? I have doubled the distance. Give me a minute. I have doubled this distance. Okay. And make a circle over here. So this is zone 1. This is zone 1. Okay. For zone 2, Again, I will take the center as the center of optic disc. But what's the radius? The radius is distance between optic disc and the nasal oral serrata. This is the radius. I will make a circle with this radius. I will make a circle with this radius. So this is zone 2. This is zone 2. And zone 3, whatever area left, that is zone 3. So this is zone 3. Let me highlight, this is zone 3. Towards the temporal crescent, temporal oral serrata. This is zone 3. So I hope you got all three zone. Okay, so these are the three zones in both eyes. Appreciate right eye, appreciate left eye, my right eye, my left eye. You can see the two eyes of the patient and appreciate the 3 zones here, appreciate the 3 zones here. So you should understand the 3 zones. So till now I taught you there are 3 zones in the retina and there are 5 stages of the disease. There are 3 zones in the retina and there are 5 stages of the disease. What I taught you this. Anyone have any confusion? There are 3 zones and there are 5 stages of disease. What are the 3 zones? Appreciate the 3 colors in my diagram for the zoning. This diagram I will use. Can you see the red circle? Red is my zone 1. Blue is my zone 2 and yellow is my zone 3. Say red, blue, yellow. Appreciate it, everyone. Zone 1, zone 2, zone 3. No confusion. The 3 zones are in front of you. Okay, now you can see the 3 zones over here. Red, blue, yellow. Zone 1, zone 2, zone 3. And you can appreciate the 5 stages. Now, these stages can occur in any of the zone. The patient can have disease. The newborn can have disease in any of the zone. If these 5 stages are present in zone 1, it's most dangerous, most crucial because they are closest to the optic disc and macula. If these 5 stages are present in zone 2, they are relatively less severe because they are a little bit away from the optic disc. And if these zones are present in zone 3, they are harmless. They are completely harmless because they are very away from the optic disc. This area is very crucial, the central area which contains the optic disc and macula. Okay, so if the disease in this area, it's crucial. If the disease is zone 2, it's relatively less crucial. But if the disease in zone 3, it's harmless. I hope you got it. So these 5 stages are present in which zone? That matters. So most severe zone, most dangerous zone is zone 1. Because zone 1 contain optic disc and macula. If these 5 disease stages, any of them is present in zone 1, the disease is very severe. If these 5 stages are present in zone 2, it's relatively less severe. If these 5 zones are present in zone 3, they are harmless. They are harmless. I hope you got it. So that's about the zones. So you got the stage, you got the zone. Now coming on the extent of the disease. Let's come on the extent of the disease. For understanding the extent of the disease, you have to understand we are comparing the retina with the clock. Can you see this is retina, this is clock. Can you see this is 12 o'clock here, this is 12 o'clock here. Appreciate the 6 o'clock, 6 o'clock. Appreciate 3 o'clock, 3 o'clock. Appreciate 9 o'clock, appreciate 9 o'clock. Appreciate the clocks, appreciate. So we are dividing the retina in 12 clocks, 12 clock hour. We are dividing the retina in 12 clock hour and comparing it with a clock. Now, if the disease is occurring, it is involving how many clock? It is involving, so disease is from here to here. Suppose the disease is starting from 12 o'clock till 3 o'clock in this area the diseases. So it is 3 clock hour, it is 4 clock hour, 5 clock hour, how many clock hours? So that will decide the severity of the disease. Okay, how many clock hour the diseases? So that is the extent. For extent, there are 2 terms we are using. See, the disease is in 5 clock hours. The disease is in 2 clock hours. So we can compare like that. I hope you got it. Now for extent, we are using 2 terms, plus disease and pre-plus disease. In the extent only, there are 2 important terms you have to understand. One is plus disease, one is without plus or pre-plus. Pre-plus is without plus. Understand these 2 terms. What is plus disease? What is plus disease? Ultimately, neovascularization is the problem. What is the problem in ROP? In ROP, the problem is neovascularization. That is, new blood vessels are formed in ROP. Okay, now the new blood vessels which are formed, are they dilated and tortuous? Are they dilated? Can you see the new blood vessels which are formed? They are tortuous. They are not straight. They are like this. The new blood vessels are like this. This is straight and this is tortuous. If they are tortuous, they are more dangerous. There are high chances they will rupture. If they are straight, there are less chances they will rupture. So problem is neovascularization. The new blood vessels which are formed. Neovascularization. The new blood vessels which are formed. Are they straight or are they tortuous? If they are tortuous, it's a plus disease. In plus disease, the new blood vessels are dilated, tortuous, and they involve more than 6 hour clock. They involve 2 quadrant, more than 6 hour clock. Okay, more than. So the disease is involving like this. It is more than 6 hour clock. 6 se bhi zyada. It is already 6, it is more than 6 the disease is involving. So such a disease is known as plus disease. So plus disease, 2 criteria. What are the 2 criteria? You can see the new blood vessels are tortuous, number 1, and the disease is involving more than 6 hour clock. the disease is involving. Okay, that is plus. And what is pre-plus? If these two criteria are not present, the newborn retina is not normal and it is not plus. It is not plus. So it is pre-plus. If it is not plus, we call it pre-plus. So you can see plus, pre-plus. This is plus disease and this is pre-plus or without plus, non-plus. Pre-plus, without plus, non-plus is same. So here you can see the new blood vessels which are formed, they are tortuous. But here the new blood vessels are straight. Okay, so that is the main criteria. If you are confused in the clock hour, leave it. So here the new blood vessels are tortuous, here they are straight. This is plus, this is pre-plus. So I taught you the extent of the disease, plus and pre-plus. So people, it's very tricky topic and I can claim that nowhere in this planet or the world, this topic is simplified like I am doing. You refer any platform, you refer any book, you refer any internet source. It is not simplified. It's a very tricky topic. I read it 100 times from multiple books, multiple sources to super simplify for you. And these images I have drawn, they are given nowhere. The super simplified images I am giving you to explain the disease. Now see how I am explaining you the management. Did you understood the zone? Did you understood the stage? Did you understood the extent? What I taught you? I taught you this. This is the summary. Now please understand this diagram. Understand the 3 zones here. Understand the 5 stages here. And understand the extent of disease plus and pre-plus here. Please do understand if you want to. Please. So what are the 3 zones? I'm teaching you a topic ROP. What are the 3 zones of ROP? You can see red, blue and yellow. These are the 3 zones. Okay, in the retina. What are the 5 stages? Stage 1, 2, 3, 4, 5. You know the 5 stages. First of all, there is a demarcation line, then it converts into a ridge, then new vascularization, then partial RD, then complete RD. You know the 5 stages. Okay, now any of these stages can occur in any of the zone. There can be combination. I will make the multiple combination. Which stage is in which zone? Okay, now the new vascularization which is taking place, it can be plus, it can be non-plus or without plus. Okay, it can be plus, it can be without plus. So the disease can be plus. This is plus disease. See the tortuosity of the blood vessel. This is without plus. I hope you are getting it. So please see the zones, please see the stages, and please see the extent. How many combination you can make out of these? I will tell you the multiple combination. I will discuss 12 combinations in management. Please understand first. I hope you got the zone. I hope you got the stage. I hope you got the disease. Now it can be zone 1, stage 1 plus. It can be zone 1 but stage 2 but plus. That's the combinations I'm making. This is what the combination means. I hope you are getting it. I hope you are getting it. Now, if you understood the stage, zone, extent, the most tricky portion of this disease is management of various combinations. For which combination you will give what management? First, you decide how many combinations you can make. Okay, you start with the zone. Zone 1 mein how many combinations? Zone 1, stage 2, stage 3, stage 4, stage 5. Now each of them is plus, pre-plus, plus, pre-plus, plus, pre-plus, plus, pre-plus. How many combinations you have made for zone 1? The same with the zone 2. The same with the zone 3. There are multiple combinations. So what is the management for each combination? Now any of the combination can occur in the newborn. The newborn can present with any zone, any stage, and any extent. Okay, so how many combinations and what is the management for each of them? So that's how I'm going to super simplify people. You're getting it. Most of the students even don't get the problem. So they don't have the solution. They are very happy. They have no problem, no solution. But here first I'm discussing what's the problem here, how many combinations you can make. And then we will discuss the solution. We will discuss the management of each combination, each combination separately.